Libby, you can start recording this webinar for reference for everyone on this call. We will record this webinar so you can reference it at a later time. Welcome to the Lobby Day Prep webinar hosted by our Council on Advocacy. Let's first do introductions. So my name is Bree. I am Columbia Class of 2027, and I am currently the chair of the National Council of Advocacy.
Hi, everyone. Good evening. I am Tarina, and I am the past National Vice President. I go to Tufts, and it's my last year.
Hi everyone, my name is Maya Lavallee. I'm a class of 2025 at UT San Antonio in Texas, and I am was the legislative coordinator for districts 8 and 9.
Hi, everyone. I'm Jonathan Kobe. I'm Marquette class of 2025, and I was the legislative coordinator for District 6 and 7.
Alrighty, so this webinar will basically go over first, what is Congress? How does it work? Next, we're going to talk about some ASDA lobbying successes, the impact of lobbying on patient outcomes, how to be an effective lobbyist, and include a mock congressional hearing hosted by Kobe and Myra. Lastly, we will have a Q&A at the end, so if you have any questions, you can put it in the chat, but also save them to ask them at the end. And just a disclaimer, this Lobby Day webinar, we are trying to make it applicable to all lobby days in general. And so this way you can take these skills and use that for your state lobby day or for a different type of lobby day. So we don't want it to be like too specific to a certain one. Next. So this is Molar Bear. This is our advocacy mascot. Advocacy, we focus on a lot of different issues from insurance reform, licensure reform, student debt, barriers to care, fluoridation, vaccinations, opioids, and COVID-19. And so each year the advocacy, I guess, issues change and develop. And so, it's always important to stay informed to see what's going on. So Congress 101. The way Congress is structured is that we have two chambers, the House of Representatives serving 2-year terms, and the Senate, 100 members serving 6-year terms, with 2 senators from each state. And usually the legislative process goes about in this way. So at the start of a Congress, a member will introduce a bill, and then it will go to a committee. So the bills are sent to relevant committees for reviews, hearings, and markups. And then there is a floor debate and voting. So if a bill passes through the committee, it moves to the floor for debate and vote. And then it needs to pass both the House and the Senate in order for it to be signed into law. And so if different versions pass in both chambers, then the conference committee reconciles them, and then there's like another, complicated process. But key thing to note is it first goes through the House and then it goes through the Senate. And so if it passes the House but it doesn't go through the Senate in time, then you have to redo through the process again. But if it does pass for both, then the final bill is signed into law. And so an important note, we will cover this a little bit later too. It is very, very important to have a connection with your congressional staffers. And so these staffers are people who you tend to meet with more often than the legislators when you go into lobby day. And so these staff members are there to help shape policy proposals, form relationships. And so it's really, really important to go in and establish a good relationship, keep in contact with them. More will be discussed in a later slide. And in particular, the way you phrase advocacy can change depending on the status of a bill. So we talked about the legislative process. It can get introduced and then it's sent to these committees and it's heard, passed through different places. And so you could either ask a legislator or ask their staffer to tell their legislator to either introduce a bill. If it hasn't been introduced yet. You can also ask a legislator to co-sponsor a bill if it has already been introduced and you need supporters on the bill to get momentum. You can also ask a legislator to support a bill. Sometimes in committees or hearings, there's a vote. And so you can ask your legislators to be like, please vote on this issue. So it really depends on what stage a bill is in the process of what you will ask your staffer and legislator. Next slide. So how does the timeline work? what happens is the bills need to be reintroduced in a new session because legislative cycles end after 2 years. So Congress works on a 2-year cycle with a new session starting every odd numbered year. So basically, the 117th Congress was between 2021 to 2023. The 118th Congress was between 2023 to 2025. And I believe it ended like January 3rd, 2025. So now we are currently in the 119th Congress, which will extend for another 2 years. And so bills not passed by the end of this session expire and are no longer valid. And so these bills must be introduced in the new Congress afterwards to continue moving through the legislative process. So I found this out when I was a first year going to Lobby Day, and I had been reading about Ensuring Lasting Smiles Act. It had gotten really far. I think it had passed this House in the 117 Congress, and I was super excited for it. And then I was like, wait, where is it? Why is it gone? And so that's when I discovered that, a lot of these bills will get a lot of momentum, but they will not pass. And so you kind of have to, go through the process again. Next slide. So why is reintroduction necessary? Each new session is a reset with new priorities. Reintroduction gives lawmakers a chance to adjust language and gather more support. Reintroduction also allows for continuity in legislative efforts, even if a bill expires at the end of the session. And it allows for ongoing advocacy. So advocacy groups such as ASDA, working on a bill may continue lobbying efforts to build momentum throughout the year. And so I want to emphasize again that change takes some patience. It takes time. A lot of these bills take, like 5 or 6 years, but that doesn't mean that progress isn't happening, even if like the bill fails after one cycle. Because what happens is, you might first get a few co-sponsors this cycle, and then you might get like tenfold the amount of co-sponsors, but it doesn't pass anywhere. And maybe the next time it passes the House, but it doesn't pass the Senate. And so the goal is to just improve how far the bill goes each time until it finally passes into a law. Next. So some examples of ASDA lobbying successes, licensure was a key thing. Before 2020, only 10 states accepted non-patient-based licensure exams. But before COVID, and especially during COVID, students successfully advocated to state boards and testing agencies that live patient exams were not necessary to assess clinical competency. And basically, at the end of 2020, there were a lot of states who adjusted licensing requirements, 34 states accepted mannequin-based exams, with others offering the DLOSCI. And as of December 2023, nearly all states have made permanent changes, with at least 48 states accepting mannequin-based exams, which is like a great move forward in terms of licensure and also just like improving ethicalness of these exams. Next slide. The medical loss ratio was another example. ASDA supported the Louisiana Senate Bill 463, which increased transparency in dental insurance spending by requiring dental plans to disclose their dental loss ratio, which is basically the percentage of premium revenue spent on patient care rather than the profits. And so Senator Bill Wheat sponsored it. It was signed into law and took effect kind of recently, January 2025. And so this is super exciting, showing that, some things don't, they might not take that much time. Other bills might take a lot of time, but regardless, you should celebrate in all occasions when something gets done. Next. And then another one, Action for Dental Health Act passed into law in 2018, partly due to ASDA's efforts. The renewal is in progress. So last year on March 7th, the House passed the Action for Dental Health Act of 2023, which was super, super exciting. ASDA contributed to a lot of lobbying efforts for this bill. However, due to the congressional session ending, we do need to reintroduce this bill. So this might be one of the legislative priorities coming up. We're not sure yet, but more afterwards.
All right, so I'm going to switch gears a little bit and talk a bit about lobbying in action and the real life impacts it has on your patient care. So the first thing that I mentioned is increase to access to care. So essentially, when we are going to our states and we're going to DC to lobbying for things like public health programs have helped to increase access to care for our patients. Some kind of examples are, your Medicaid expansions, fluoridation in water, and this has all really helped underserved populations get improved access to essential dental care. Another good example is improved patient safety. We know our patients can't really advocate for themselves when it comes to things like dental products and the standard of dental products. So what we do is we will advocate to our legislators, whether it be state or federal, we advocate for stricter regulations. A really good example for this is implants. When implants was a really new thing, a lot of people had hesitancies. And so we were making sure that we were advocating for a safe device that we would, incorporate in the body of our patients. And then the last thing I'd probably bring up is prevention, better prevention and awareness. And we know this is extremely important because, especially currently, in the climate where we have a lot of talk about fluoridation, lobbying during this time looked like lobbying for public health initiatives, like anti-smoking campaigns, uh, lobbying for oral health education. And we did all these things to help to reduce incidents of preventable oral diseases for our patients. So you can go to the next slide, Libby. Um, so on this slide, we're going to talk about some of and Bree kind of already touched on a few of these, so I'm just going to kind of like list them off. But these are the real impacts that lobbying had on patient care. And the number one thing that I would like to point out here is the expansion of Medicaid benefits. That was the Affordable Care Act that during the Obama administration, something was expanded for our patients for increased access to care. The same with the dental insurance benefits specifically for Medicaid. Um, Another good thing that I talked about earlier was the fluoridation efforts. And Bree mentioned the changes in dental licensure exams. A new one that is not often talked about, but is extremely also important in this climate is the increased diversity in dental schools. A lot of people don't realize that that was actually an act that was passed for a few of like institutions, like summer programs for STEM and health professional education programs. Um, and so that was something that was lobbied for to come into fruition. Um, Also, I don't know if any of you, but I am a National Health Corps scholarship recipient, and HRSA is also called HRSA. Um, that is another kind of like an organization under the federal government to support students who want to serve in underserved or low health provider shortage areas upon graduating medical, dental, nursing, different type of health profession environments after they're done with their education. And so that is something that even to this day we lobby often for the funding for that program. Um, and then last but not least, but the greatest of all, student loan reform. That is something that we continue to lobby for, not only for students, but people don't realize like it's also for the patients. The more we can relieve on the dentist, the medical doctor, when it comes to student loans, the better it is for that patient because now you won't find dentists trying to filtrate certain cities just to pay back loans because the pay rate is higher. Um, but yes, so essentially this slide is super imperative for us to recognize that not only are we going to Lobby Day in our states and our federal levels for ourselves, but also for positive patient um, impacts as well. Next slide. So in conclusion, lobbying could definitely lead to positive and or negative outcomes. For patients, for us, it really just depends on the interested party that is representing the policies that are being presented into the House. Advocacy efforts must always balance the need of patients with the interests of various stakeholders to ensure that lobbying efforts result in improved patient care outcomes. So good luck out there, guys.
And I'm going to go over the next part, how to be an effective lobbyist. So obviously understand the issues that are being talked about. So for example, and know what you're lobbying for. So last year, the points that the ADA was going over was the DOC Access Act, and then student loan reform issues and oral health workforce issues. So know what wherever either ADA or at your state lobby day, know what's going to be talked about, and then have main points and some data research on these things. So really you just want there's not a lot of time to talk to the people. Obviously, you want to make sure you get everything concise, and then you just want to have like a few sentences that summarize the issues that you're talking about. And the more details and everything can always be followed up with an email. And you can go over that like in further communication, but really you just want like main points. So you're not like giving them way too much information because they see a lot of people throughout the day. And we're not the only people going usually. Even at state lobby days as well, there's a lot of other organizations going. So you just want to make sure you have main points, and then all the other research and everything can be in an email. And then be effective at communicating. So again, obviously all of the issues have a lot of research and everything and numbers behind them. If you go to the ADA website, at least for last year, the issues that were talked about, they have a PDF of a lot of detail on everything. So really you just want to summarize when you're talking, but there's a lot of information. So you don't want to word vomit and give them all that information because that's not really the time. You just want to be as effective as possible. And then the next thing is just being confident whenever you're talking to them, because we know more about dentistry than the legislator or the staffer that you're talking to, and not in a like pretentious kind of way. It's just this is our field. So we do know more just because we've been in it. And then Bree also touched on this, but you may not talk to the legislator specifically. You may meet with their staffer, and that's okay. Most of the time, they're taking notes, they're jotting everything down. They're going to give this information to the legislator because normally they're, uh, very busy, obviously. But they're going to be, that's their job is taking all the information. They're going to have give that to the legislator. So just, be ready that you may not talk to them directly. And the next slide. And then also, this is a great time to build relationships. Again, there's not a ton of time, but you can always find common ground, get to know the person you're talking to, and then obviously get their contact information to follow up and send this information. And then whenever I went for my state lobby day a couple years ago, they, especially about student loans, they were like, well, what is your specific like story with student loans? And they kind of gave me the floor, and I was able to tell them specifically for me, and that can be a time to kind of get to know them as well and build relationships. So they might ask you a few questions as well, just to get to know you. They are humans, so you can talk as long as there's not a lot of time, but you can still get to know them as well. And then know your audience. Obviously, not everybody agrees on everything. So you may get some pushback on some things, and they may like disagree with you, and that's okay. You just stay respectful. You just keep your composure, and you try to find common ground, something that you think that maybe they would listen to a little bit more, like shift a little bit. But also, stand your ground, but be respectful, and don't be discouraged if someone doesn't see the same as you as well. That's okay. Another thing that Bree had mentioned is just being persistent and patient. Change doesn't happen overnight. You may not get the outcome right away that you're looking for, but you just have to be patient with it and work with others. I mean, obviously, this is a great opportunity that we're specifically for ADA Lobby Day. We're going to be getting to go all together. And so we can all talk about these issues together. And we're all going to be in the room. I mean, not all in the room together, obviously, but there will be a few of us so you can work with each other and get different outlooks on things, and just, enjoy this time for us with us that we're going to be together for ADA Lobby Day, and just talk to everybody and keep up with all the issues that we're talking about. And next slide.
Awesome. So, Myra and I are going to go over a little bit of a mock congressional meeting. It's going to be very, just kind of a template for something you could use uh, when when you're at your state or state lobby day or in Washington D.C. coming up. So we'll start with that. So we'll just be going over kind of covering um, one bill here, and then we'll kind of skip to the what would be like the end of your meeting. So we'll start with that, and then I'll go into my slides after that.
So I am gonna be the role of the senator.
And
So
I'll be the student.
yes. Good afternoon. Welcome in and take a seat.
Thank you, Mrs. Senator. We appreciate you taking the time to go over some of these important issues facing dentistry today.
It's great having you here today. What is the first topic you'd like to discuss?
Well, Mrs. Senator, here we have the Doc Access Act. This is legislation that would inhibit insurance companies from dictating the fees that we can charge for services that they do not cover.
What specifically would be a non-covered service?
So when we're looking at non-covered services, they can range depending on your insurance plan. However, some that it usually includes are, things including teeth whitening, cosmetic resins, cosmetic veneers, additional cleanings beyond the covered amount of cleanings on your insurance plan, and therefore the insurance company is not going to be reimbursing us as the provider for this service, but they are dictating how much we can charge for that service.
I see your concerns and I understand what you're explaining. I'll bring all this information back to my staffers so we consider co-sponsoring the bill.
We really appreciate that. We know you take a lot of time and you guys will sift through all the information thoroughly. Do you have any questions about this piece of legislation or need any clarification?
Yeah, I have one question. Why are medical colleagues not included in this piece of legislation?
Ms. Senator, that's a great question and observation. That's something, unfortunately, I don't have the answer for right now, but definitely someone with our team back at the ADA would be willing to help answer that question. I will let them know, and they will send someone on your team a follow-up so you can get more information on that. But if you have no further questions on that issue, I think we can move on to the next one if you're all right with that.
Yes, that sounds good. What is the next one about?
Okay, so now I'm just going to kind of forward to kind of like a closing portion of it. So that's kind of what it would look like if you do, you would do one bill and then you'd hop into that next one. Just some little transitions there. So there's kind of what um, when you're closing out the session, what it will look like once you're done with all questions and you've kind of clarified everything. So, Mrs. Senator, that concludes the three issues we had to discuss today. I appreciate your willingness to meet with us today. It was a pleasure. We'll have our team back at the ADA follow up with your office on clarifications on questions you had asked. Thank you again for all you've done so far to support our profession, and thank you for your time.
You're welcome. Have a great day, and I'll look forward for a follow-up with your contacts from the ADA.
Awesome. So yeah, that's just a little bit, kind of what it looks like. And definitely from people I know, that's kind of what a lot of our meetings felt like last year when we were in Washington, D.C. on the Wisconsin end of everything. But that doesn't mean that, like I said, there might not be more pushback certain places. Sometimes some of these bills are, very cut and dry for these legislators, and they are, more than happy to yeah, kind of tell you right there on the spot, like, oh yeah, I would love to support that, or I need to look into that more, or um, they give you a pushback on, oh, why do you want to charge more? Why can't the insurance company do that? And that's all right. And like we have talked about before, if you don't have the answers, we have great staff at the ADA that can help get those follow-up questions. So now I'm going to go into some keys to lobbying. So bring paper copies of the issues when you go into these meetings. It's super important to be prepared. These individuals have days, like we said, they're filled with meetings. So the more prepared you can be, it can kind of help you stand out when their brains kind of racking at night of like who they've all seen and what they need to, follow up on and what they need to talk to their staffers about. And And having those physical copies can allow them to just take note right on that sheet of paper of, what they liked, what they had questions on. So when they get that follow-up email or their staffers get a follow-up email, everything's right there in front of them. And then knowing your story. We've talked about kind of having that personal story that you want to talk about. And it's also okay if maybe you don't have, a super impactful personal story. But that's why it goes back to being prepared, where you may reach out to a classmate, you may reach out to a friend, a colleague, and say, hey, I know you have talked about something that relates to this bill. Can you tell me a little bit more about that story? And would you be okay with me sharing that when I'm at the lobby day? And being able to do that just allows you, I think it's powerful if you tell your own story, but if you're able to go in there and say, hey, this is a discussion I've had with a colleague and they want me to share this with you because they can't be here, that means a lot to those staffers and legislators because they understand that you're thinking about this, not only while you're here in front of them, but in your free time and you're really just trying to grow dentistry for the best it can be. I think the next thing is just having a positive attitude going into it. I know sometimes people might be going into a meeting with someone or staffers that they may not be looking forward to, be that, just differences on where they sit on past bills, what they've co-sponsored, what they've refused to sponsor, but just making sure you go in every time like it's a fresh start and just making sure you can clarify any questions for them and just stay positive and it'll be good. So when we're talking about the meeting aspect of it, you want to go in, you want to make sure, kind of flows in with being positive. You have that smile, you have that handshake, and you're just repeatedly reminding them how grateful you are to be there. Like we said, they take a lot of time out of their day. So a little appreciation, which I think we all realize, being dental student goes a long way. Days when you don't get that little appreciation is real tough. So just thanking them is super important. Like we've said, they're all humans and that all touches our heart a little bit when we get that smile and appreciation from somebody. Another thing we've touched on a little bit here is just we have that limited time. Be effective, be clear, and be concise. Tell your story, get your point across, and maximize the amount of time you have in those meetings because there's a good chance that, they have someone coming in 45 seconds after you leave. And so you want that to be impactful and powerful. So they remember that, maybe keep them thinking about that when the next group's in there. Another super important thing is to be nonpartisan. You'll hear it a lot. If you're coming to lobby day, they'll be talking. If you haven't heard it before, you're hearing it now. We're the tooth party. We don't sit to one side or another. We just want to represent dentistry and make dentistry the best that we can and support the growth and prosperity of our future. So just making sure, you're representing that tooth party, you're staying right down the middle. There's a reason we pick the resolutions and bills that we do, and it's because we can just stay, streamline everything kind of right down that middle so we're not, making one side or the other, frustrated with us. A couple other things here to remember is the staffers are important. I think some people initially may be disappointed if they don't get to meet with that senator or that representative that they, constantly are seeing in the news making big headlines or something like that. But I think it's really important to remember, and something that I learned in my first lobby day, that these legislators are advised usually by people right around our age. So being able to share your narrative, your personal story with someone who connects with you is, way more meaningful than somebody who, isn't from that same generation. I think that's especially important to remember when you're talking about student loan reform, because you're usually talking to someone who probably is in the same position as you when it comes to student loans. So it's super important to just let them know what you're going through and that potentially it's, maybe even a little bit of worse situation because you've went on to more schooling depending where, they kind of fall. So just remember, it's a lot of individuals right around our age. So connecting with them that way is super important. A couple other notes to touch on here, and you'll probably hear it. You don't want to overcrowd the offices because you don't want to overwhelm them. They're taking their time to come out of their day. You don't want to, frustrate them when you have, 80 people lined up down the wall, and you can't, all you hear is rustling of suit coats and business professional clothes. They can't even focus on the bills at hand. We've said it a bunch here. Personal stories and narratives are so powerful. Tell them with passion, tell them with emotion, make them powerful, leave a mark on them, and that will help us day in and day out. Um, Also, it's okay to not have all the answers. You know, we're dentists, we're students. We do all do that first. That's what comes first in our lives. So it's okay if we don't have all the answers to the policies and how it's worded and everything like that. That's why we have such a great support staff back at the ADA and lobbyists in your state, in Washington, D.C., who are willing to back us up and answer those questions. So the only thing we ask you to do is if you don't have the answers, that's perfectly all right, but at least have a contact for them to reach out to and know who's going to be following up on that. And finally, just remember to breathe. It can be something, especially in your first time, it's super intimidating. You're walking into this office and you're like, okay, this is someone who's like a real heavy hitter here. They make the big calls, but we've said it once, we've said it twice, I'll say it a third time. They're people just like us. They have families, they have kids, they're a mother, they're a father. Hit them with emotion, hit them with a powerful story, take a breath, and they'll be great and happy to listen to you.
Alrighty, so some conclusions from this. Stay informed. There's a lot going on right now in Congress on the federal level, so many changes, and so it's important for you to do your research, especially when you go into lobby day too. Your advocacy today can influence the legislation that affects the dental profession for years to come. That's like super, super important to know. Even though advocacy doesn't happen overnight, it can make huge changes. We talked about licensure, we talked about like fluoridation or expanding access to care. And even if immediate changes aren't made, your efforts are part of a larger movement that can lead to lasting improvements in public health and dental care. So just keep that in mind. I know it's sometimes kind of nerve-wracking, but it feels so empowering when you are sitting there in the office. So just want you to take that away. Also, pro tip, if you say I'm a constituent when you enter the office, like their ears will perk up. I feel like it's like, oh, I'm a constituent. This is how it'll impact like my ability to practice in my state or like, my other like community members or whatnot. So constituent, just like keep that word in mind too. But anyway, thank you all so much. I think this is the end of our presentation. So does anyone have any questions? You're welcome to submit in the chat or raise your hand. So this is actually something that you might be talking with your team when you are going into lobby day. Usually, if you go in as a team, it's a lot better to send a letter as, a group and then have individual sign rather than, like having the staffer receive 3 separate letters that have the same message. So yeah, I'd say some things depend on what's going on with the advocacy initiatives that we're doing. So As to Action is a tool that allows you to send a lot of letters to legislators. And in cases where you're just like really pushing like quantity, it is important for more people to send it. But in the specific cases of lobbying, and when you are following up on something that you just lobbied for, just send one message. Be more concise with that. Yes, this is recorded. The slides, I guess, can also be made available. They will also be in the recording. How will you approach a legislator or staff who doesn't believe in evidence-based research or a specific science principle that supports one of your points? So I guess this is a hard one. The important thing is to stay true to the facts that you have. no matter what, like it can be intimidating sometimes when they're like, oh, is like, I don't believe in this, but you just, like include the facts, include the statistics, like be prepared with like citations or like research that you have like on hand that you can like reference in case they push back on certain things. I think it's also important to recognize that when you talk to like Democrats or Republicans, like you might have like different ways to approach talking to them. Like for instance, like Medicaid, expanding Medicaid dental benefits. Like for Democrats, you might talk about like expanding access to care, serving our populations. But for Republicans, sometimes you might talk about like bringing people back to work or like saving hospital systems get more money from preventing like ED visits. So I think sometimes it's just like thinking about like where the legislator is coming from and like where they might be concerned about and addressing like their key concerns, whether it's like how are we going to fund this or um like I don't believe in this. Like you kind of just have to look at like think about like where their disbelief is coming from and try to address that.
I would add too, just make sure that with anything that you're talking about, try to have a personal story and even not just like your own life personal, but maybe a friend has shared something with you about what we're talking about when it comes to like evidence-based. I remember my first lobby day. I was I think I was the first year, and I walked in on the group learning about the ELSA Act, which is about the surgery that deals with the cleft lip and cleft palate. And one of the young ladies who was in there, she had a friend that was at this time 20, and she was still fighting to get her cosmetic surgery for the defect that she was born with. And so her even just in that room sharing that story, I think a lot of people were, and it was a lot more detail to the story, but a lot of people were kind of empathetic after that point, even if they knew nothing about, you know, the pharyngeal uh development of how that cleft lip formed. After her sharing that story about her friend and adding a little bit of science with it, people in the room were like, wow, like that's actually interesting. So I think sometimes it's really good. I think the best lobbyist, the best person to advocate is someone who talks to other people and get their feedback on what it is that the policy is or the resolution of the bill is on the floor.
Yeah, just to echo too, like if you tell this congressman, yeah, I've seen this with my patients, like I've literally seen it. Sometimes it helps. It's like if they can like visualize it too. What's the next question? Kobe or Myra, do you want to give a rundown of what each day of the ADA consists of, kind of from what your experience?
Yeah. Um, So one, I know that updates will be sent as long as you're registered for Lobby Day. You should be getting those weekly updates from Sarah Milligan. So more agenda and everything for like this specific year will be sent through that. And then I don't remember what the app was. It through the ADA app last year that you had like your specific like meetings and stuff scheduled. So keep up with those emails from her for more updated stuff as well. But last year, and anyone jump in if I'm remembering it correctly. I remember that first day being, it was more meetings, kind of, it was meetings of like, certain bills that we're going to be talking about as well with it was, they went over like, I always pronounce it wrong, but I think it was ERISA. Um, and then a couple breakout rooms just of legislation and things that were going on, just kind of to familiarize yourself with lobbying and everything that first day. And then that second day, you had breakfast. You then had time to meet with whatever state you were going with for your meetings. And then you didn't have a ton of time. I think, maybe an hour or so, kind of developed your stories, who was going to talk. And then, you went to your meetings for their, appropriate time. And then that third day was similar, where maybe had a meeting or so in the morning, and then you just went with those couple of people who were scheduled in those meetings with you, and you guys developed your little stories beforehand, and then you went and you were all set.
Yeah, the key thing Kobe mentioned was the ADA Day app. That's going to be like your holy grail, because it'll have stuff in there that talks about like who your congressperson is. Um, it'll tell you, like Kobe said, the times that you're going to have your meetings on the Hill. Um, and it was my first time and I felt very lost the first time that I went. However, the day that you step into the hotel and you register, you're gonna get like a load of information on site. So don't worry, and nobody's gonna be intimidated. Everybody's gonna be really helpful. So don't be nervous about that.
If the senator has questions on topics, who should we tell them to reach out to for further information? So this is something that if you're live in the session and a senator does have a question to come up and you don't know the answer to, you should tell them, I don't know, but I will get back to you. And usually you will get your senator or your staffer or whoever's business card. And so through that business card, you can like relay some of that information back. ADA does have dedicated lobbyists who will be in constant communication with these senators as well. So like they can also like answer bigger questions. But if there was a specific thing that came up in your session, best practice is to be able to like respond exactly as is because it's like telling them to reach out is they're so busy. So try to take that like burden off of them and get back to them and compile it too. Remember, like make sure within your team you figure out who the spokesperson is to email.
The fact sheets will also you'll get the fact sheets when you register and they'll have them on the a list of them on the back.
The next question is if I'm a Republican and the congressman slash congresswoman is a Democrat or vice versa, how do we make sure our views are not unlawfully biased? Does someone want to answer this question? I'm happy to, but I figured leave some space for.
Oh, sorry. Well, yeah, y'all can jump in too, but I think if they're get obviously the ADA is says that we are bipartisan. So the information that they'll give us is bipartisan information. So really you just want to go off of that. And just, use what they've given you because they've done all of this research for us and given a lot of information. So I think the best is just stick to what we've been given. And just be respectful. And then if I feel like they will also be respectful as well. And you just keep on going back to what the information we've been given because it is the bipartisan information.
We're the Tooth Party. Remember that. Yeah, we are, regardless of your own political opinion, I think it's important just to take a step back and remember, like, we are advocating for the Tooth Party, the teeth population oral health for our patients. And so sticking with what the ADA has given and like keeping that in mind. Where can we find the 2025 Lobby Day issues, and are we only allowed to discuss the ones posted by the ADA? So, to answer the second question first, during ADA Lobby Day, like don't discuss other issues aside from the ones posted by the ADA. You are able to join many other different lobby days. Actually, the next day there is ADEA, American Dental Education Association plus AAO-DCR. They're doing a partnership lobby day advocating for like NIH, NIDCR, like funding issues, federal grant issues. And so if those are issues that you're passionate about, you can also join them. Different organizations have different lobbying priorities, so it's important if you are representing that organization to stick to the talking points presented by that organization. And the issues, I believe, are still being finalized. So the ones that you see on the website are the 2024. There might be some overlap, but there's still a lot of change happening right now, so cannot give an update until they are fully finalized.
And if you're not getting any emails from Lobby Day, it's probably because you're not registered yet. And I don't know about everybody, but like some people are being registered by other people. And then some people, their schools are registering them, and then some people are registering themselves on their own. So some of us, I know I'm registered, so I've been getting emails, but if you're not, you probably haven't. So don't be alarmed. It's probably just because you're not registered yet.
I just realized I was muted. Um, wait, does anyone else want to read this question? Kind of embarrassed now.
I can read it for you, Ben. Um, in relation to the Action for Dental Health Act of 2023, HR 3843, we are thinking of sending multiple senators a letter as a team. I looked online for their office mailing address and was planning to mail it with that. Is this correct, or does the ADA website have another way of sending letters? Thank you. Um, if it's a act that's on the ADA Lobby Day issues, I would not recommend sending any emails just because like there are different security levels that have to be followed um whenever you're like mailing.
Yeah. I think from what Trina said earlier, mailing probably no, but emailing, you can send via email, because security measures have to follow for mailing are really, really long. And so ADA does have like existing templates for like emails and stuff. So you can always look at the existing email templates. Emails generally are faster. Alrighty, no other questions? Any last ones? Alrighty, if there are no any other questions, then we will be closing out this Zoom call. But you are welcome to email the advocacy department if there's any questions that arise throughout the year relating to advocacy concerns. And yeah, like keep up to date, as the action is a tool that you can sign up for to, like get get text alerts, get notifications about what's going on. And so the biggest important thing is to stay informed. And this webinar should be posted and we are recording it. So you can always access for future resources. Anyone else have any last thoughts? Alrighty, well, thank you everyone. Take care. Have a great day. Good luck with advocacy and Lobby Day.